Hey guys, this is Dan with Pain For You. I'm at a different location today. I was driving back from the bank and I figured I would stop off at this canal. It's along the Delaware River, which is through the woods over this way. But there's this canal and it's got a lot of leaves in it. It's kind of gross, but in any event, it's a nice peaceful place. Figured I would shoot here since it was on the way home from the bank. Anyway, today's topic is going to be Rage Against the Machine. And I'm not talking about that hard rock band. Basically, I'm talking about the rage that many of us have felt, still feel, at the machine called the medical, the medical industry, right? Because we run into a symptom, which we now know is caused by TMS, too much stress, tension myositis syndrome, this mind-body process. And we go get medicalized and we look up on Dr. Google and you start seeing scary stuff. You go to the doctor, they can't help you. They give you drugs, surgery, injections, all sorts of treatments, specialist to specialist. You get sucked into the machine and chewed up. And before you know it, you've spent years with failed medical treatments. You have spent thousands, tens of thousands. I've met people who have spent $100,000 or more on failed medical treatments, and they get chewed up by the medical machine, if you will, and they finally come out the other side and say, maybe there's a different way to look at this, and that different way is TMS, stress illness, this chronic state of tension, this conflict between all these normal human emotions that we all feel, but that we don't want to feel because we've been taught they're bad. And we've decided for ourselves they're bad. And they're unpleasant, so we try to avoid them. And so we've got this conflict inside. But the topic of this video is the rage against the machine, and what do we do with that rage? Right? I mean, so many of us, when we start talking about the doctors and how they screwed us up and they made us worse, they told us we were broken, right? They literally convinced us that we're screwed and that we're not getting better, and learn to live with it. It's a lifetime of pain, especially if you've gotten a diagnosis like trigeminal neuralgia or fibromyalgia or any other uncurable thing, right? And when they say it's uncurable, it's because these doctors can't figure it out with their typical scalpels and drugs and injections. Right? Because these processes don't work. Now, why is it that mainstream medicine cannot solve the chronic pain problem? It is because chronic pain is not a structural fix-it problem. It is a problem that is created by TMS, too much stress, chronic state of fight or flight, this inner conflict between our emotions and repressing and running away from them. Right? We know what TMS is. It's that. So you cannot fix a psychologically created process with drugs, scalpels, injections, or surgeries. You just can't. That's literally like saying my car won't run. Okay, let's change the tires. It's not going to do anything, folks. So that is why the mainstream medicine world and that machine is completely incapable of solving the chronic pain puzzle, if you will. I was thinking about a concept before regarding this, and pain happens from tissue damage, right? We know that. You fall down, you scrape your knee, ooh, that hurts. It'll sting for a while until it kind of heals and you can watch it heal. Pain can also happen, an acute onset of TMS. Oh, I bent down, oh, pulled my back out. Sure, no you didn't. Your back is still perfectly where it was before. You didn't do anything. Very rarely do we have true injuries to our spines from doing something as innocuous as bending over or lifting something. Because if something's too heavy, you won't be able to pick it up, right? I don't believe we have a lot of injuries that way. I think we have an acute onset of TMS, as I've addressed in a recent video. Chronic pain is when our brain and our neural pathways learn to keep the pain signal firing. And how do we do that? Through fear, focus, and anxiety. right? You may have an injury, a true one. You may break a foot or an ankle or a leg. And if you're freaking out about those symptoms and not healing right because, oh, I had an uncle who had a football injury in college and he never got better. He still limps. He still hurts when it rains. Right? If you have that belief and you worry about it and you freak out about this true, like a fracture, you may still have pain in a long time out. Well, how does that happen? Because the fear, the focus, and the anxiety and the expectation that it's not going to heal properly teaches your nervous system through neuroplasticity that you're not going to get better. And therefore you don't. You literally taught your nervous system to keep on sending and firing those pain signals long after that true injury healed. So that can happen. But what if it comes on from TMS or this mind-body process? Well, you can also, through fear, focus, and anxiety, teach yourself that you're broken and you believe and you fear and you focus and have anxiety about the symptoms, and then you're literally teaching your nervous system to stay in pain. Now, let's say, let's say the circumstance that was going on emotionally in your life has long passed and you are no longer in that emotionally distraught stage. It is very possible that you've just learned these neural pathways and the pain is continuing to fire because of the whole mindset side of this equation. And I'm going to do a mindset overview, kind of like I did the process overview a day or two ago, where I kind of mapped out all the various processes. I know I've shot mindset videos, but what I'm going to do is kind of outline it for you, write it out, and show you all the various concepts that I have that kind of make up what I believe to be the healing mindset or the pain-free mindset. So, that being said, rage against the machine. What do we do with that? Let's say we are furious at the medical system. Let's say we want to go scream at our doctors because you're doing better with this TMS approach and they're such idiots, and what do you do with it? Well, you can take a proactive approach. One of the young ladies that I met at the Omega retreat, she literally bought some Sarno books and brought them into the pain clinic and offered to leave them there with a little note that says, hey, this stuff changed my life, you might want to consider it. So she was doing a very gentle and kind approach there, and that's wonderful. And one person at a time, we can start to change the world and make a difference. So if you're going to go vent and vomit your anger at these medical practitioners, I'm not sure that's going to be helpful. I'm not sure it's going to get you anywhere. They're just going to turn you off. So I don't know that that's the approach. You can do what I'm doing. You can start sharing the information in a way that you find is going to help other people, right? You can not do anything with it, and that's okay too. You don't have to change the world. But what I will absolutely encourage you to do, now that you know about TMS, now that you know you can get better, now that you know you are getting better, rage against the machine. Let it out. Journal it out. Scream it out. Feel it. Get the lesson. The lesson is that these doctors, most of them are well-meaning, and they're doing what they were taught in medical school, and some of them are just as frustrated as you are with their absolute inability to help you. You want to see a deer caught in a headlight? Walk into a brand new doctor's office and go, I've got chronic pain and I need you to fix me. They're going to look at you like, huh? Because they don't have the answer. So that could actually be a fun way to have some to get some giggles out of this experience, is, go from doctor to doctor and just scare them with, I'm in chronic pain and I need you to help me fix it fast. Anyway, I'm joking around a little bit here. So what do you do with this rage against the machine? Feel it. Give yourself the permission to feel it. Get the lesson, which is that it's not taught in medical school. Yes, you can blame the financial end of this, the hospitals, the pain clinics, the pharmaceutical companies all stand to benefit by us being in pain and staying in pain. So it's a very good reason why none of this mind-body stuff has really taken a hold. It's because there's no financial incentive for the medical industry to latch onto it. They don't benefit by it. You know, you take a spine surgeon. How's he going to make a living if he doesn't do surgery anymore? And I'm not saying feel sorry for him. I'm just saying it's just the way the way of the world right now. That being said, you have the ability to own your own health. You have the ability to get your mindset dialed in. You have the ability to learn how to feel these emotions. You have the ability to gather this knowledge, learn about it. You have the ability to do the assessments to say, absolutely, this is me. I've got the personality types. My pain characteristics are absolutely TMS. They started based on my pain history when this was going on in my life. You have the ability to change it. So if you're raging against the machine and you're staying stuck in that story, one, you have the opportunity to step out and go, I'm not going to keep on doing the same things over and over again and expecting a different result. If you're going to the chiropractor and not getting better, if you're going for acupuncture, massage, injections, surgeries, and not getting better, step away from the machine. You can do that. You can now take ownership of your life. Learn about TMS. Do the self-assessments if you need to, and you've got a very serious situation. I was just exchanging messages with the lady about trigeminal neuralgia, atypical. I'm telling her, go see Dr. Schubner, or at minimum, send her your reports and your scans and consult with him, even from afar. He'll do that. Same thing with another lady who was asking me about osteoarthritis of the knees. She's got, basically bone on bone, and she's asking me to say, should I get these double knee surgeries that they're recommending, knee replacements that they're recommending? Look, I can't really answer those questions. All I can suggest you do is take the information that you've got and work with one of the TMS medical doctors. Go to ppdassociation.com or .org, ppdassociation.com. Look at the list of doctors, who's on the team there, and reach out to one of them. They are still in medical practice. If you have a significant, serious concern where you're not really sure if it's TMS or not, and the pain characteristics don't really line up great with TMS, meaning it's all day, 100% constant, it doesn't change, it doesn't move, it doesn't go up or down with stress, heat or ice doesn't help it, those types of things, reach out to Dr. Schubner or David Clark or David Schechter or any one of these folks, right? You owe it to yourself to get checked out and have a medical doctor who is knowledgeable about and an expert in TMS help bridge that gap between, is this structural or is it TMS? The vast majority of us, 99% of us, probably are dealing with TMS, and you can often make that assessment. I'll try to link below the assessments that I talk about. But if you're really got that serious situation where it looks and feels an awful lot like it's structural, do yourself a favor. Reach out to one of those medical doctors from the PPD Association. The best doctors in the world who are practicing a TMS approach are at the PPD Association. So if you're not sure, don't wallow in indecision for months and months on end. Because honestly, this work isn't going to work if you're still going, but it's physical, but it's physical, but it's physical. I'm feeling my emotions, I'm raging at the machine that they can't fix me, but it's physical. Like, look, don't leave it to chance. Talk to one of these expert medical doctors. They're physicians who care and are helping people out with TMS. And in the very small percentage of cases, they will tell you flat out, no, I'm sorry, I've seen your x-rays. Your knees are bad enough that you need a knee replacement. Dr. Schubner said in his interview with Eddie Lindenstein of the Mind and Fitness podcast, he said a certain percentage of people have such degeneration in the hip that they do need a hip replacement. Not everything is TMS. I believe most of it is. right? But not everything. So if you're not sure, get checked out by one of these TMS doctors. Do yourself that favor. So instead of raging against the machine, sometimes working within the machine, but with the right doctors who are trained in TMS, can help bridge that gap. So for those really severe situations, that's what I'll recommend. For the rest of us who know with absolute certainty that it's TMS and we've either gotten better or we're on our way, get the lesson. The lesson is your doctor was probably a nice person who just wasn't equipped to deal with your symptoms because it's not taught in medical school and it's not rewarded in the financial aspect for treating you with a mind-body approach. And so, get the lesson and then let that rage go, because holding on to that rage and holding on to that resentment for the medical industry is doing nothing more than keeping you miserable and keeping you a victim. Look, step away from that victim role. Know that you can get better. You know, I get messages all the time. People are saying, I'm starting to feel better, Dan. This is great. I'm getting the mindset dialed in. I'm doing the work. And they're starting to get better. You can too. So, don't rage against the machine. If you do, just get the lesson. It's not their fault. They're just doing what they were taught in medical school. If you want to rage against anybody, rage against the medical schools never mind. Don't go there. So, hopefully you found this helpful. And let me know what you think. Are you still raging against the machine? If so, comment below. And if you did something proactive, like, you know, drop off some books at a pain clinic or anything, what was the reception like? Were they open to that? I think more and more places are getting more open to that, but they're not going to quit their practice. There's a few people who have done it. A couple of physical therapists, a chiropractor, Dr. Mike Murray, and Jim Prusak, he's a physical therapist, and these guys are jumping into this mind-body stuff. Kudos to them for seeing the light and being willing to take a stand and not continuing to do these treatments that just weren't really working so well. So, love you guys, love you gals. Comment below, let me know your thoughts on this whole rage against the machine concept and what you think we should do about it. I think we should gently plant seeds all over the place. Let people know, this is what's working for me, this is what worked for me. You should check it out. Read a book by Dr. Sarno, right? Tell people about this stuff, but don't push it. I can't even push this stuff on my own family. All I can do is plant the seeds and show people how well I'm doing, and sometimes tell stories of all you wonderful people who are doing great and supporting my efforts here with all the kind words and success stories. And you can get better, folks. So it's up to you. We'll talk to you later. Thanks.